An Introduction to Bone Marrow Failure by Praneeth Abburi, Brandon Zhou, and Rujal Chitrakar. Bone marrow failure. Sounds scary, right? In fact, failure tests to any body part will send chills down your spine. Well, there's more to it than its scary name. However, to understand bone marrow failure, you must first understand bone marrow. Bone marrow is a soft, fatty substance in the center of bones where most blood cells are produced, including white blood cells and platelets. Now with this, bone marrow failure occurs when the bone marrow's ability to produce all of these kinds of blood cells is compromised. While there's no single cause of this, there are a group of fairly uncommon disorders that can be inherited or caught that help trigger it. The most common cause, however, is a disorder known as aplastic anemia. Aplastic anemia induces the failure by damaging and destroying the marrow's hemopoietic stem cells, the cells that produce new blood cells. Now obviously, lacking the ability to create new blood cells is certain to have effects. Sure enough, bone marrow failure can cause fatigue, weakness, fever, numbness, and without treatment, even death. Now this raises a question, what treatment is there for bone marrow failure? Well, one treatment option is blood transfusions, injections of blood into the person that fulfill their body's immediate needs. But since these cells are short-lived, this is only a short-term relief. However, stem cell transplants offer a more long-term solution. Since most causes of bone marrow failure result directly from the destruction of blood stem cells, this treatment is also an effective one. By replenishing these cells, the body can now create new blood cells, and further, this only needs to be done once due to the stem cells' ability to renew themselves. So as you can see, bone marrow failure is a very complex issue, but with the resourcefulness of stem cells, there is still hope.